Hi, everybody. This is Ernesto from Filmit.com. Filmit.com is dedicated to helping mental health professionals develop a web-based presence. I am so delighted today to speak with the writer of this book, Graduate Course You Never Had. Dr. Larry Waldman here, he wrote this book for people who are thinking of going into private practice. When I deal with a lot of students who say that they want to go into private practice, they get a shock on what it entails for private practice. And I wanted to interview Dr. Waldman to give us an idea of what private practice will look like. So, Dr. Walden, welcome.
Yes, hello.
How are you doing?
I'm good. Glad to be here.
Good, good. Well, tell us a little bit about this book and what inspired you to write this book, The Graduate Course You Never Had.
Well, I had been doing seminars on the topic of practice development and management for a number of years, basically through the Charter Hospital Network. I was the director of psychological services on a consulting basis for the Charter Hospital of Glendale from 1988 till 2000. And I basically went around the country to other charter psychiatric hospitals doing workshops for school districts and for laypersons, but also for other mental health professionals on the development and management and marketing of their practice. And after doing that for, about 10 years or so, I decided I probably ought to put it into a book. And thus I gave birth to, if you will, the graduate course you never had.
And so coming across your book was really refreshing to me just because a lot of the things that I wanted to do in my private practice, I wanted to be more meaningful. I wanted it to really reflect who I am as a therapist. And the first stages of my private practice wasn't easy. Could you speak a little bit to the reality of private practice in the mental health field?
Sure. Well, to begin with, as you said, it typically takes a lot of work to get started. It doesn't happen. It doesn't happen immediately, and it takes a lot of effort. In fact, I talk a lot about this topic, and one of the things I point out is that for most people starting out in private practice, you need to spend more time out of your office than in it in trying to market it and let people know that you're there, and
Absolutely.
let people know what kinds of services you offer.
Absolutely. Some of the things that I come across with some of the questions that students have for me is, private practice is not only fulfilling, but there's a lot of hard work to it. There's a section in your book, again, the graduate course you never had. You speak to the idea that, or you ask the question, is private practice right for you? Could you elaborate on that and try to enlighten us or licensed therapists who are starting off as a private practitioner?
Sure, of course. When you have your own practice, you can't assume that everything is going to be working in proper fashion.
Absolutely.
Again, if the secretary calls in sick, if the fax machine stops working, if the copy machine goes on the fritz, and so forth, all that is on you to make it right. You have to be very organized about getting your notes done on time, getting your paperwork done. Frankly, I know lots of therapists who are excellent clinicians, but frankly never made it in private practice.
So what I'm hearing from you, Dr. Walden, is that a good clinician, one who is in private practice, needs to understand the value of hard work and how to get their clients. And you're saying that you lose a lot of sleep when you go to that whole process of getting your private practice along the way. Am I correct?
Absolutely, you have to be prepared to work hard, and the job doesn't stop when you get home. In fact, just this evening, I brought home two folders that I'll be working on at 5 o'clock tomorrow morning.
Wow.
You also have to be entrepreneurial. You have to be always thinking about ways to enhance your business, find another way to market yourself effectively, and things like that. Also, you need to be flexible. Frankly, you're dealing with the public, and sometimes people are going to disappoint you. They're not going to show up. You're going to struggle with payments sometimes,
Right.
and all of that is encompassed in private practice.
Yes, absolutely. You know, some of the things that I notice in in my journey as a private practitioner, there's a lot of things that I never thought I'd had to do, like making phone calls, meeting, getting clients. And you mentioned in the book that you have to hustle your clients, or that you have to market yourself on a consistent basis, or else they're not going to come. I think a lot of new clinicians think that when they get their master's degree or their license, that it'll just carry them throughout their practice and the clients are going to come in droves, right? But the reality is we have to consistently market ourselves and also market ourselves in very creative ways. What makes a good clinician and a successful clinician in private practice?
Well, frankly, I believe it's marketing. I'm assuming, of course, that the clinician has some basic skills, but the truth of the matter is, you could be the best therapist in the county, but if no one else knows who you are or where you are, it's just going to be you waiting for the telephone to ring. So to be truly effective and successful in practice, you're going to have to market yourself and that you are an effective therapist.
Awesome. And I do want to say again, this is Dr. Larry Waldman, who wrote the book, The Graduate Course You Never Had. Again, I really, really encourage all of you to pick this up. The reason why as well is that at the end of every single chapter, it gives you action steps, and it gives you accountability on what you're going to do next in your ways to market yourself and to make your private practice as healthy as possible. Again, the book is A Graduate Course You Never Had, and this is Dr. Larry Waldman. Dr. Waldman also speak to the idea of creative marketing. From your perspective, what do you see as creative marketing?
Well, there's a number of things. I like, for example, thinking big, if you will. Instead of simply knocking on individual doors of potential referral sources, what I like to do is to think about, where do my referral sources gather? Uh, how can I speak to or meet a bunch of them at one time?
Mm.
So, for example, a couple of months ago, I and another attorney did a workshop for personal injury attorneys here in Phoenix. There were 45 attorneys in the audience, and I did a seminar on recognizing and managing post-traumatic stress disorder in the personal injury client.
Mm.
So instead of knocking on 45 individual doors, I was able to
Get
speak
them all in one room.
all in one room, exactly. Not to mention, of course, I love speaking as a marketing tool, because when you are up in front, you are automatically designated as the expert.
Absolutely.
And in fact, I just today, so help me, I received another call from another attorney referring two more clients to me. So that workshop is paying off big time.
Absolutely. And to just echo your point, I think getting up in front of people, doing speaking engagements with other professionals within not only just your field, right, but also teachers, pastors, lawyers, social workers, nurses, all those people that will most likely refer to you. And you're right, being up there on stage and really doing this, you become the expert in the room. And that's when you can get referrals as well too. And I really do appreciate you saying that, because I think that is first and foremost in marketing yourself, going out there and actually really teaching classes and doing seminars to get those clients.
Absolutely. Along those lines, I like writing articles. I've been making a real push to write articles in the last 9 months or so, and I can't tell you the impact that it's had on my practice. Articles are an excellent way to go and getting them published in the local media. In fact, one of the sources I use is my own health club. They put out a monthly newsletter, and they excerpt my articles on the back page. I can't tell you how many clients I've received just through that.
Wow. And another point too, I think for those of you private practitioners out there that cannot get an articles to be published to a major publishing company or organization or whatever, you can also do blogs. I think the internet has made it possible. You've got WordPress, you've got Blogger to make it possible for all of us to get our pieces out there, and some of your articles and your writing as well.
Exactly, and I have a blog going as well, and I've gotten a number of referrals and actually interesting opportunities that way.
Absolutely. Again, for all of you who are listening, this is Dr. Larry Waldman. The book is The Graduate Course You Never Had. I'd really recommend that you pick it up if you are thinking and actually in your process of being a private practitioner. The other thing that I do want to mention is Dr. Larry and I are planning on a seminar in the summer. And this will be a two-part series where I talk about the marketing piece, the video marketing, and how to have a very powerful online presence. And Dr. Larry Waldman will be speaking to the managed care part of private practice, and you will know everything that he mentioned in this book on how to have a successful private practice. Doctor, thank you so much for this time. I look forward to speaking with you again, and I'm sure there will be times where we will do this again so that we can get your name out there and your book out there as well.
Well, thank you, and I look forward to promoting our summer workshop again.
Great. Thank you so much. Look forward to seeing you soon. Bye-bye.
So long. Goodbye.